Hello, this is Cynthia Normack with Pearls for MPs. Today I'm talking to my colleague Cynthia Brown, who's a nurse practitioner who performs veteran disability exams. Cynthia, can you tell Pearls for MPs your role as a nurse practitioner? Can you just tell them about yourself?
Sure. So my name is Cynthia Brown. I've been a nurse practitioner for about 5 years now. I'm an adult-gerontology nurse practitioner, so I mainly see adult patients. Currently, I work doing VA claims and disability exams, and that just involves me doing physical exams on our veterans and service members who are preparing to leave the military and enter civilian life.
And can you just tell me why did you decide to become a nurse practitioner?
So prior to me being a nurse practitioner, I worked in an acute care setting for about 10 years. And I just saw other NPs working and realized that with this advanced role, I could manage patients differently in a different capacity. And so that really sparked my interest.
Oh, that sounds great. And just tell me more about like the duties you do with the veterans.
So my day-to-day is I work full-time. So I see veterans who may have had some sort of injury, whether it be to their back, to their knee, and they have some issue that's continuing to affect them after service. And so my job is just to assess their injury that they have currently or their function that they have currently, and then to review their medical records to see the details of their initial injury and then put the pieces of the puzzle together. So that I find really exciting and fun.
Yeah, it's a definitely exciting, different type of role as a nurse practitioner. And my last question is, what is your advice for future nurse practitioners?
Oh, that's a good one. So I would tell anyone that wants to be a nurse practitioner, it's definitely a rewarding job. It's, definitely something that I have found to be more rewarding than I thought it would be. But I would tell, anyone going into the profession, definitely to get some nursing experience under your belt before you go right into being a nurse practitioner. That clinical practice will really help you once you become an NP. And outside of that, find a mentor. Find someone, even if it's not a formal mentorship, but just find someone that you're going to keep in your network that is doing what you're doing and what you want to do, so that you can bounce ideas off of them. You can call them to, ask questions should you need it. But a mentor is very important. And then lastly, just know that you went to school, you got your training, because you're going to have some challenges that come up, but just know that you're meant for this role and that you're going to succeed.
Oh my God, that's great advice. Thank you so much, Cynthia, for highlighting the NP.
Thank you.